What do you think is the best thing we can do for our adrenals? Like maybe some adaptogenic herbs that were used for thousands of years also?
Well, I think that we have also to look at some advices of our older generation. For example, in some religions they have time of fastening. And on the other side, they have times of not to eat some things, and also they have a more relaxed day. You know, you eat at some times in the older generations. You eat in the morning, you eat in the midday, you eat a little bit in the evening. We have to look what could the old generation give us advices, and maybe we have to reflect, shall I also take some advices from them?
Wow, so look at the traditions
Yes.
and modern
Yes.
science,
Yes.
and then
Yes.
integrate that together.
Yes, I think this will be a very, very good way for us, for the human beings.
But if we live like that, there is not a lot of space for pharmacy then.
Well, I think the pharmacy is a Greek word. And the pharmacy, it depends how you pronounce the word pharmacy in Greek. The one meaning is pharmacy as a therapy, as a gift, and the other meaning is pharmacy, if you pronounce it with another way, as a bad thing, as a poison. So I think everything has to be in our society, and we have some very old and very perfect pharmacies. But everything is also a matter of how you use it, how often you use it, when you use it. The matter of awareness, what we are doing for our patients.
How do you see a cancer disease, like a cancer diagnosis in nowadays?
My opinion is that the cancer diagnosis is a multifactorial disease. It's not so simple that we said, okay, we have only one bacterium or one virus and one damage or one. No, it's a multifunctional disease, and I think a patient with a diagnosis disease has to have also a multifunctional doctors, nurses, and other team players in the medical field.
So more as a strategic plan, not
Yes.
just trying everything I can.
You're right. We have very good, also in the whole world, at the university clinics, in other clinics, very good protocols, very good researches. And I think the cancer patient has to have a multifunctional approach.
Thank you so much for your answers.
I thank you very much. It's
Thank
an
you.
honor. It's an honor. Thank you.